Over to the Correctional Service Choir to give us a national anthem. Thank you.
Before we can continue with anything, can we then be welcomed by the Deputy Mayor Mapaseka Mutibinkwani?
Ha HIV Day, ha. HIV Day, ha. Yes. Dumelang. Good morning. Goeiemorgen. Salibonani. My role is very little, and let me run on it like a postman. Thank you, Program Director, MEC Monsensiu, to Dr. Joe Phaahla, Minister of Health, to the Premier of the Free State, Mayor Hexonia Sifuran Tombela, to Steve Litsike, the Chair of SANAC, civil society, all MECs who are here, and all councillors in attendance. Homorena Neo Mopedi, the chair of traditional leaders, to the ambassador from the US, to Mayor Eva Kimango from UNAIDS, to the colleagues, friends who are here, ladies and gentlemen, and all stakeholders from different councils, all protocol observed. Good morning again. My name is Mapaseka Mutibinkwane, the Deputy Executive Mayor of Mangaung Metro Municipality. I would like to take this opportunity to welcome everyone in attendance today. I am deeply honored to be the host and to share this important day with you, and most important, to commemorate World AIDS Day. And as we continue our commitment towards HIV/AIDS prevention and treatment at the highest level of our government, let us also not forget to applaud the hard work and dedication of our frontline healthcare providers, community organizations, the Ministry of Health, and international partners for their contribution, support, and effort in promoting healthy society. Every year, we should take time to reflect on how far we've come since the early days of AIDS epidemic. And those of you who lived through it remember all too well the fear and the stigma and how hard people with HIV had to fight to be seen in our society, or to be heard, or to be treated with basic compassion. And you remember how little we knew about how to prevent AIDS or how to treat it. What we did know was the devastation that it inflicted on all of us, striking down vibrant men and women in the prime of their lives and spreading from city to city and country to country seemingly overnight. Today, that picture is transformed thanks to the courage and love of so many of you in this room and around the world. Awareness has risen. Research has surged. Prevention, treatment, and care are now saving millions, saving our people, not only in the world's richest countries, but in some of the world's poorest countries as well. And for many, with testing and access to the right treatment. The disease that was once a death sentence now comes with good chance at a healthy and productive life. And that is an extraordinary achievement that we have. If we as a people and as a country want to see changes and progress in combating this disease, then we need to act like it. And by doing our part and by leading the world to do more. We need to work hard to create and promote the first comprehensive national HIV and AIDS strategy rooted in a simple vision that every person should get access and life-extending care, regardless of age and gender, race or ethnicity, sexual orientation, gender identity, or socio-economic status. As a country, we are making progress. But we are all here today because we know how much work remains to be done. We need to keep focusing on investment to communities that are still being hit hard. We need to keep up the fight in our cities and to offer support to those who are infected and affected by HIV/AIDS. We need to make sure that we work hard in preventing new infections, increasing access to treatment for those who really need it, and fulfilling the promise to those on treatment by making sure that access to the best ARVs continues without interruption. We need to work towards a more sustainable and resilient healthcare system to protect our communities into the future. Ultimately, this virus and the suffering it caused must serve as a motivation for all of us to continue striving towards universal health coverage so that all people in all countries and communities have access to all the healthcare services they need for all the health threats they also face. On this 1st December 2022, World AIDS Day, we should be honoring the vital and various contributions that communities around the world make to the HIV response. It should also include everything from addressing the stigma, discrimination, and defending human rights, to increasing access to life-saving services and ensuring that people are at the center of policy making and implementation. It is clear that the expertise and drive of communities is crucial to ending AIDS as a public health threat by the year 2030. And we need to amplify the critical role they play today and every other day. Mangaung Metro AIDS Council stands in solidarity with the community of Mangaung, and we are also committed to working closely with them and other partners to achieve the HIV/AIDS-related targets. At the intersection of gender-based violence and HIV, women and girls are excessively affected. Gender inequalities limit freedom, autonomy, and meaningful access to social and economic opportunities. Inequalities and violence against women and girls are directly linked to rising rates of HIV transmission, particularly amongst adolescent girls. Stigma and discrimination remain a pervasive barrier to openly declaring one's HIV status. We must come together to lead organization, address stigma and discrimination, and advocate for the rights of people living with HIV. We should work hard to encourage others to be tested, access available, and treatment also. And we should also speak out and champion change. We must also work hard to provide equitable access to medication, vaccine, and health technologies. Protect human rights and build trust and tackle this pandemic. We must be elevating essential workers and providing them with the resources and tools, the tools of trade that they need. We urgently need sufficient community-led and community-based infrastructures as part of a strong public health system. We need policies to ensure fair and affordable access to HIV treatment. We must protect human rights and build trust in health systems. It is this that we will ensure we close the inequality gaps and end AIDS. But the problem is that they are too often applied evenly, they are underfunded and are underappreciated. I salute the frontline communities that have pioneered the approach shown to be most effective, that have driven the momentum for change, and that are pushing leaders to behold and urge to keep pushing. Program director, all of us who are working to end this epidemic, we will decide to put communities first in our work to make financial and human support of young people and for women in a priority, and most importantly, to give first place to compassion of each other. We must unite with the goal of saving lives. As I close, we must invest in more scientific innovation for prevention, testing, treatment, and care, and empower communities to lead the response on the ground. We must find national pathways towards sustainable long-term financing of HIV response. All these are achievable only if we are prepared and willing to participate and work together. If we focus and work harder and faster towards 2030 goal, and all this can be achievable. And with those words, I want to say, enjoy your stay here in Mangaung, and may this day be fruitful as we all want it to be. Thank you so much.
Ke tla ba phoso e kgolo ha nka ema mona as a program director, but be ke sa dumedise di political head and principals that are here. Didi Mabuza dumela, Didi Mabuza dumela, Didi Mabuza dumela, dumela, we Didi Mabuza dumela, hey Didi Mabuza dumela, Didi Mabuza dumela, we Steve Litsike dumela, Steve Litsike go dumele, Steve Litsike dumela, Jo Phaahla dumela, we Jo Phaahla dumela, we Jo Phaahla dumela, dumela, Sisintombela go dumele, Sisintombela dumela, Sisintombela dumela, Lita musheba li mushebe, Lita mushebe la mahala, Lita bulawa kipilu, dumela, we muntengo go dumele, we muntengo go dumele, we muntengo go dumele, dumela. Thank you very much. All protocol observed. I thank you.
Ka mora ditumediso tseo tse monate haholo, re kopa modulasetulo wa ntlo ya rona ya marena, Morena Neo Mopedi, ho tla beha mantswe ka pela setjhaba.
Mohlomphehi Motsamaisi wa mosebetsi kapo batsamaisi ba mosebetsi e re ke lebohe sebaka se leng fang sona ka pina ene monate o dumeisang baetapele ma utlwa bohloko hore ha wa re morena ne o dumela kana go tle manna ntle le senya nako ke utlwile Deputy Minister wa Traditional Affairs Hansi Mameza, the program is too long, then I will be short. Imba ngibeka feta without kidumedise tuna kholerona Afro State Mbentombela, Minister rona wa Health, all deputy ministers present, kidumedise all the MECs for Free State government, Marena Aka, Lady Khosi Zedin Kwano, Deputy Executive Mayor, and all the leadership of the municipality, ambassadors, Sarona, Barumua Barona, Hosla America, all the leadership of SANEC, Kaleshompa, Bimbaga, Benzi Rebetin Kwano, Dingaka tsa rona tsa setso le baruti ba rona ba re kopanya le ntate modimo ka thapelo bomme le bontate ke a le dumedisa pula ke a leboha bahlomphehi beng ba ka. We are here today as leaders, community members, and as Africans, to unite against HIV and AIDS, because Africa is still a continent with a high rate of HIV infection around the world. We are here because South Africa still records new infection of HIV and AIDS every day across black, white, and colored community. 41 years ago, when the first case of HIV were officially recorded, South African and the rest of the world were scared. And we thought that the virus is going to wipe off the mankind from the face of the earth. But science kept on giving us hope. God kept on giving us hope that one day we will defeat this virus and live life of HIV free. Program Director, we are clearly a resilient community. We stood the test of time and fought this monster for 41 years, and we will continue to fight until there is no one in South Africa, in the world, which is living with HIV and AIDS virus. Rele marena. Re etsa bonnete ba hore re lwantsha kokwanahloko ena ya HIV. Mme re etsa bonnete ba hore re kgothaletsa setjhaba sa rona. Ke nahana tsatsi la kajeno re tlile mona hore re tlo kgothaletsa setjhaba sa rona hore by test for HIV, by itshireletse, mme ba ithute ka HIV, hobane ha e soka ba e fela re ntse re phela le yona ha se ke ra lebala. Re theile mekgatlo e mengata re le ntlo ya rona ya marena, mme re etsa kgothaletso ho setjhaba sa rona hore ha re beng lentswe leng. Re theile mokgatlo o reng ke banna khotla, moo re le baetapele ba borena re tlo kgothaletsa banna le bashemane hore ha ke re duleng khotla moo moro o sa okole mafura, re bue ka ditaba tse amang banna. Re theile mokgatlo wa bommatjhaba moo le teng tse re kgothaletsa batho ba rona hore ka nnete ha re etseng bonnete ba hore re ba mekgatlong ena ho tla lwantsha kokwanahloko ena ya HIV and AIDS le lefu lenana le se le kene le letjha la gender-based violence. Motsamaisi wa mosebetsi, re kekebe ra kgaotswa ho lwana, re kekebe ra kgutsa ha fela kgodumodumo ena ya HIV e ntse e tswela pele. Re re ntwa re tla e lwana senna, mme re tla etsa bonnete ba hore ra e wina. Matla! Ke a leboha.
Morena ne o dumela, Morena Mupedi dumela, Morena ne o dumela, dumela. Ha ke batlo patala go ke entse intentional hore ke tlo mo dumedisa ka qeta bua, ha ke bitse morena nna, ha ke tlo khona ho bitsa morena wala ke mo dumedisa after. Thank you very much. Now ke tlo emisa a comrade, activist and national leader of PLHIV sector ka hara naha. I'm going to call Comrade Selom Khalipi to come Atlorifa Molaitza from the people living with HIV sector at national level. Kodua yena liaibonana. Kodua yena kodua liaibonana. Kodua yena liaibonana. Kodua yena liaibonana. Esichaba siyapena. Liaibonana. Kodua yena liaibonana. Esichaba siyapena. Liaibonana. Thank you very much. Thank you very much, Comrade Silo.
Amalda! Amalda! Viva PLHIV sector South Africa, viva! Viva South African National AIDS Council, viva! Amalda! Long live the spirit of activism, long live! Hello, comrades. Let me start first by greeting and acknowledging the presence as well of the minister in the Free State. Premier, just to save time, to thank you for hosting this big event. MEC and say, let me observe the protocol because I can't go one by one, but Comrade Steve, specifically as the chairperson of civil society in the fight and response against HIV and AIDS. Thank you so much. Let me say, we started on the 7th in terms of making social mobilization and working together with the Department of Health in making sure that people across Mangaung get access to services. And I would like to acknowledge and appreciate the partnership of working together with the Department of Health during this period. Indeed, we managed